The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
I'm Agatha Thrash, a staff physician at UT Pines Institute. Today, our topic for you is breast disease, not only in women, but also in men and some in boys. So we'd like you to join us.
Welcome to Help Yourself to Health with Dr. Agatha Thrash of UT Pines Institute. And now, here's your host, Dr. Thrash.
You know, a lot of lifestyle habits have to do with the production of breast disease. Now, we have learned at UT Pines Institute that a lot of people who have chocolate in their habit, that they are among those who are likely to get breast disease of some kind. And so we'd like to talk with you about various lifestyle habits, but I'll talk about chocolate first. Now, the first thing that we can say is that if a woman eats a lot of chocolate, she's very likely to develop a condition called fibrocystic breast disease. It's a common breast disorder that a lot of women have. It's characterized by painful, sometimes swollen lumps that may concern her quite a great deal because they may be quite hard and not so easily movable, especially when they are inflamed. A young woman doctor who was about 30 was eating chocolate every day of her life until one day she went to a foreign mission field, and while she was there for 3 years she could find no chocolate, so she ate no chocolate, and during that time she had no breast disease at all. Now, this was quite remarkable because she had been having a biopsy of her breast for approximately 5 or 6 years, once every 18 months. So when she came back and realized that when she started eating chocolate again, that her breast disease came back, she spoke with her surgeon. The two of them began to investigate other women who had fibrocystic breast disease. And sure enough, they found that a number of women would cease to have fibrocystic breast disease if they gave up use of chocolate and sometimes coffee, tea, and colas as well. These are beverages that are related. Now, because fibrocystic breast disease occurs in women, and it really is quite common in women, you might think, well, women are those who get breast disease. But it isn't always so. There are times when men get breast disease. And Dr. Wynn Horsley, who is my associate at UT Pines, is going to be talking with you about that. So this is Dr. Wynn Horsley. He is one of my associates at UT Pines. And you're going to talk about, is it gynecomastia? Or as I've heard you sometimes say it as a Canadian. I've sometimes heard you pronounce it, what is it, gynecomastia? Which do you prefer?
Well, you know, I've heard plenty of variation on so many words in medicine. People think that there's only one right pronunciation, but reality is different, I think.
That is true, and I think that in the British-speaking, more British-speaking countries, like Great Britain, they have a completely different way of speaking about medical things, and they may have a completely different terminology. So what do you have to tell us about gynecomastia?
Well, gynecomastia, I would like to just say one little word about the term itself. I haven't studied this up in the dictionaries, but I think the roots are well enough known. Gyneco is a root that means woman, as in the word gynecology. Mastia refers to the breast. You would think that with that kind of a word you'd be talking only about women, but in fact this is used quite specifically for problems that men can have in their breasts. One young fellow, an adolescent, when I was in medical school, came complaining. I think it was his mother who actually came and talked to me about him having some pain right under his nipples and little lumps there. I looked at it, trying to look like I was full of knowledge, but as green as could be, just starting medical school. And he told me about how this was rather tender and painful, and he was worried, you know, was something developing here that would need some drastic treatment. I studied up some on the very issue, and fortunately I was able to counsel patients at that time, and then in following times that I saw him, could carry on further in explaining that in fact this often does happen to adolescent boys. Now, gynecomastia is used, I would say, even more to describe abnormal growth of what is actually breast tissue in older men. So let's make it clear, we're not talking about someone who's fat, especially fatty around the breasts, or a man that's got well-developed pectoral muscles that will bulge at times. And if you put the two together, sometimes it does look like there's quite a breast there in a man. But we're talking instead about actual growth of tissue, and this would be breast kind of tissue. The males, human males, do have some breast tissue. In fact, it was a surprise to me not long ago to learn that the incidence of breast cancer in men is 1%. And in fact, it's more dangerous when they get it than women, because there's not a large amount of tissue there, and it will very quickly invade the chest wall. Well, this issue of gynecomastia, breast starting to grow, can come on. One of the instances that has stuck in my mind as being the most important is in alcoholics. Most people realize that with alcoholism, you're damaging your liver. The liver is the big chemical factory of the body, and it handles processing of hormones. Both men and women produce some of both of the sex's hormones. In other words, men do have things like estrogen in their body, and if they're not going to accumulate, they have to be gotten rid of by the liver. Well, a poisoned liver, a damaged liver such as occurs in alcoholism, doesn't do this well. And therefore, there can be this abnormal stimulation of whatever breast tissue is there to start growing. A number of other things can lead to gynecomastia, and the principal point here is it's drugs. There's a fair list of drugs that will do this. Obviously, hormone type of drugs would do it, but aside from hormones, there are others such as digitalis, a drug that's used for the heart, reserpine that has been used for high blood pressure, and quite a long list of possible drug causes of gynecomastia. Now, aside from those that are considered medical type of drugs, we have an example in the illicit drugs, marijuana use. It has been specifically linked with gynecomastia in males.
Mm-hmm. Well, that's very interesting, and I appreciate that very much. You know, we have a lot of problem nowadays with women not knowing how to do breastfeeding. It has been shown that if a woman breastfeeds, she's less likely to have certain types of diseases, especially cancer of the breast. And so I'd like to show you how a woman should know how to do this kind of little office for her infant. And here I have a very nice chart which shows the positions that the mother can use in helping her baby to nurse, and that will be comfortable for her. Here is one which is probably the most common, when the baby simply sort of sits in her lap and she feeds the baby with the right breast. The left breast can be fed with the infant actually behind the mother, such as you see here. You can see that the infant is sort of tucked under the mother's left arm, and she is feeding the baby from the left breast. Then there is also the partial tucked under the left arm of the baby, with the nipple of the right breast, the one that the baby is nursing from. But the one that many women like a lot is the one that you see here, where the mother is lying down. This is often what occurs in the nighttime. When the baby must be fed during the night, then she can continue to lie down and simply take the baby cradled in her arm in this way. Now, how does she get the baby to take hold? That is called latching on. And here we see that the mother somewhat pinches up her breast. She supports it from below and sort of squeezes a little bit from above, and then makes it so that the nipple stands out. If she just strokes the baby's cheek a little bit, the baby will usually open the mouth and turn toward the breast. And then as the baby moves toward the breast, or as she moves the baby toward the breast, then she puts the nipple in the baby's mouth. Now, the baby gets a good hold on the nipple and does not want to turn loose. And so consequently, if she wants to feed from the other breast, she must disengage the baby who is latched onto her with a good bit of suction by simply inserting her finger at the corner of the mouth of the baby, and that will allow air to go in and break the very tight seal that the baby has made with the breast. And so by doing this, she can perform an important office for her baby. I don't make a lot of house calls anymore, since it became so dangerous for women to be out at night alone, or even out in the daytime alone, but generally have people to come to me. But there is one reason why I will make a house call, and that is if a young mother is threatening to stop breastfeeding her baby. I generally go study the way that she does her breastfeeding, how she sits, how she holds the baby, the timing of it, and all of this kind of thing, so that I can help her to know that she does not, for the most part, need to stop feeding her baby. Now, we have here some things about food. Oh, this looks so good. And I think it's made out of soy. It looks very much like a dish that would be good for the breast, because soy is one of those foods. This is Lydia Seda, who is my colleague at UT Pine. She's a lifestyle counselor. Lydia?
Yes, Dr. Agatha, tofu is quite good for the breast and for breast cancer. Why? Well, one thing that it has is that it helps to lower LDL. And LDL is a fat. It's not a fat that's beneficial for the body. Number one, it can contribute to atherosclerosis. And there have been studies in France that show that women who eat high amounts of fat will have greater tendencies of getting breast cancer. So this is why tofu is an excellent meal to help reduce the chances or the likelihood of acquiring an illness like breast cancer. Also, it is high in protein. It has about 7.8% protein and is nearly nutritionally complete. Also, it has iron, about 4.7 milligrams of iron. Now, the recommended daily allowance is about 15 milligrams for women and 12 for men. So if you were to eat about 8 ounces of tofu, you would be getting about a fourth of your daily recommended requirement.
Mm-hmm. Yeah, that's very good. So soy is a very nice addition to the American diet, and unfortunately it isn't used as much as it should. And I see you have a package here of tofu. Where did you get that?
Well, this was purchased at a health food store, but you can actually buy this nowadays in any supermarket. It's becoming quite popular to purchase tofu. And something else very interesting about tofu is that it can help individuals, especially women, who are either premenopausal, postmenopausal, or who are actually going through menopause at this time. What happens is, because of its high estrogen, it can help not allow those intense episodes of heat to be so bothersome, what we would normally call hot flashes. So it's very beneficial for women who are going through those experiences.
Where do you buy this? In the frozen foods department, or is it on the shelves?
Well, this particular package would be in the frozen foods department. And now there are other packages that you can buy in a box and that you would get just off the shelf as well. And they can be used to make a tofu cheesecake if you like.
Well, do you have a recipe for this delightful dish that you showed us earlier?
This dish right here is called chipped tofu. And this dish, what you would do is you would have a broth of what we call chicken-style seasoning and water. Matter of fact, you would need 2 cups of water and 1 tablespoon of chicken-style seasoning.
Good.
Along with the following ingredients, which would be 1.5 cups of tofu, 1 cup of water, 1/2 cup of cashews, 1 tablespoon of onion powder, 1 teaspoon of chicken-style seasoning, 1 tablespoon of soy sauce, 2 teaspoons of cornstarch, and 1 cup of water, and this will make a gravy. You have then your cubed tofu, and then you put your gravy with your tofu together. You let it boil a little bit, a gentle boil, and then you have chipped tofu, which you can place over whole grain brown rice.
Sounds good. And the rice, as I can see there, looks a little bit different. It looks a little fluffy. How'd you get it to do that?
Well, what I did, Dr. Thrash, is that I placed it in a skillet and I dextrinize it for about 30 seconds to 60 seconds. And what that does is to help brown it.
By dextrinize you mean you heat it and it browns a little bit.
Exactly.
Well, that's very good.
You heat it, it browns a bit, and this actually cuts the cooking time and makes the rice taste a little bit nuttier. And I placed it in a slow cooker, actually a crock pot, and after 2 hours I have nice fluffy rice. Not gummy rice, but fluffy rice.
I like
and also
sticky rice too.
You like
but most Americans like nice fluffy rice.
And the wonderful thing about a whole grain rice, a brown rice, is that it has all the nutrients that you need, especially if someone is trying to combat a cancer. It has the antioxidants and phytochemicals that the individual needs to help guard against cancer. And it's true that some white rice has the nutrients placed back in, but usually not all the nutrients. And we need all the nutrients we can get to be able to fight these types of illnesses like breast cancer. So that's why I recommend the brown rice instead of the white rice.
Yes, very good. And in places of the world where they use a lot of rice, of course they do have healthier breasts, and they're much more likely to be strong and resistant against a variety of diseases. And we have also a number of other lifestyle problems that can make us more susceptible to disease. Another problem that women have is that they often wear a lot of padding across the chest, and this padding, or even padded bras or very thick vests that they may wear across the chest, all of these can cause a problem for a woman who has a susceptibility to problems with the breast, like fibrocystic breast disease or cancer of the breast. So one thing that I always teach women to do is to be careful about excessive padding on the chest. Uplift bras, which change the configuration of the breast, may also be a problem and a source of breast disease for women, and of course a lot of discomfort. So the newer bras that do not count on a lot of padding and a lot of uplift, these are more helpful than the kinds of bras that women have been wearing in recent years. Now, not only do we have these kinds of lifestyle problems, but a lot of other kinds of things are involved in the breast. And I have here Don Miller, who's one of my counselors at UT Pines. He's a lifestyle counselor and a longtime colleague, and he's going to talk with you now about some other lifestyle issues.
There are some real important things we can do, and I want to start with children. Even a young girl who takes soybean products, and Lydia just got done talking about tofu, which is a popular tofu product, but a young girl who takes soy products as a young girl reduces her risk of breast disease by 50% as she gets older. Now, and that woman who continues to take soy products throughout her life reduces her chances even more. And the instance of soy products on the market are just unbelievable. I use a soy milk all the time. That's my favorite type of milk. As a matter of fact, we recommend for women with breast disease and breast cancer not to use cow's milk because that increases the growth of breast cancers. But we have soy products. As a matter of fact, this one has that little international symbol of breast disease or sympathy for people with breast disease, a little pink ribbon. And this comes on these containers, and they're telling you this is good. Another nice thing about soy products, and I like this, is normally if it's a soy product, you don't have this long list of ingredients. And this is the way I do my shopping. Whenever I go shopping, if I want to find if a product that I want to eat is good, I take off my glasses and I look at the ingredients. And if I can't read the ingredients, which are using very, very small print, I figure there's things in there I don't think I want to put in my body. As a matter of fact, sometimes I have to take a magnifying glass just to discover what other people are eating and say, I don't think we want those things in our bodies. As a matter of fact, I'm reading in this one something that's not good for women who have breast disease, and that would be a hydrogenated fat. And so if you see hydrogenated fats or partially hydrogenated fats, don't use those things. They're bad for people with women with breast cancer. And so find things that you can read without your glasses, and if you got great eyesight, still only 4 or 5 ingredients. But there are many, many soy products out there. There's the soy milks, there's the tofu that Lydia talked about, there are soy cheeses, there are soy cream cheeses, there are soy sour cheeses, there are soy beans, there are baked soybeans, and Henry Ford once made a soy car. And so there's lots of things you can do with soybeans, and I suggest that we eat those things because they'll make our bodies feel a whole lot better. But there are other things besides soy products that we can eat that will make our bodies safer, and not just the women who might get or do have breast cancer, but all of us should be eating these things. As a matter of fact, our mother's been telling us how to prevent all these cancers since we were children. She'd lean over and she'd say, eat your vegetables. And so we should eat our vegetables. The brassica family, the cruciferous family, the mustard family, all of these foods. Now what are in these families? Well, you've got your bok choy, your cauliflower, your Brussels sprouts, your Brussels sprout, all these different foods. You got your mustard greens, your collard greens, your kohlrabi, a lot of different foods in these families. Just eat your green leafy vegetables. That's a nice way to put it. You eat your green leafy vegetables. It will help with the breast cancer. Other things that you can do. I've already talked about staying away from the hydrogenated fats. Flaxseed. Flaxseed is a nice anti-inflammatory. I would suggest you get some flax seeds. Don't get ground flaxseed because it oxidizes very, very fast. It goes bad. It'll become rancid in just a couple of days. Get some flaxseed and every morning grind you up a tablespoonful and put it over your food. Very, very good for women who have breast cancer. It's as a preventive of breast cancer and a good food for anybody with any inflammatory response anywhere in their bodies. There are other things that you can do for your breast cancer is stay away from dairy milk. I think I've already mentioned that. Dairy milk promotes breast cancer, and it's best to stay away from the dairy milk and the dairy products altogether. And if we do some of these very simple things that God has shown us to do, we will have a good chance to fight the breast cancer, and even better, to avoid getting the breast cancer in the first place. And so, mothers, feed it to your children. Mothers, feed it to yourselves. Fathers, boys, everybody, eat the soy products because I believe this is the way we should be going in our society today. Dr. Thrash.
And also, there are just soybeans. We can just take the soybeans. There's nice recipes.
Very good.
Scrambled soybeans. I like that very much. And then just boil up some nice soy limas. They are also delightful and eaten every day. They encourage good strong bones and a lot of other things.
And you can roast them like peanuts.
Oh yes, you
and
can
there's
do that
soy
too.
Peanut butter, soy butter, nut butter. So these are all very good.
A lot of good soy products today on the market. So I'm very thankful that we can have all these products that are so strengthening to the body. We've talked about gynecomastia, as the Canadians say it, and I'd like to find out a little bit about the treatment, and so I have asked that Dr. Wynn Horsley would talk with you again a little bit about the treatment for gynecomastia.
Okay, Dr. Thrash. Well, the treatment is very simple. We've mentioned that In the cases of drugs, you can get quite a few different drugs that will cause gynecomastia. We didn't even list them all, but they're really quite common drugs. Stopping them generally brings about healing, brings about total resolution of the problem. If we're talking about the young man that I mentioned, the adolescents that sometimes get these little tender areas in their breasts, just wait. Just give a few weeks to months, and that generally clears up quite well.
Mm-hmm. Well, that's all we need to know then. Thank you so much. For women who have a family history of having problems with the breast, they need to understand a number of things in the care of the breasts. Let me just mention several things that we have in our counseling sheet for patients. One is to keep the breasts very small. Doing so has multiple advantages. One is that you yourself can feel any abnormal density or a lump that may develop in the breast. Also, when you're getting a physical examination, the physician can locate breast problems better in the small breast. And the second thing, the more overweight the breast is, the more likely it is to develop a cancer. Then daily cleansing of the nipples with a daily shower, especially for younger women whose breast secretions are quite a lot. This will help to keep the nipples in good shape. Then an injury of the breast, which we now know is a precursor of cancer of the breast in some women. Injury to the breast should be treated, such as with contrast baths, hot and cold, hot compress for 3 minutes, and a cold compress or even an ice compress for about 30 seconds. Repeat this again and again for about 3 to 5 exchanges on a daily basis until the breast is no longer tender or blue if there was a bruise there. Then the first day of each season, a woman needs to examine her breasts herself. That means that she should look at the breasts in a mirror, especially with the light coming in from the side so that any highlights of any lump or increased density in the breast could be easily seen. Then she needs to have the hands very slippery, such as might occur if she were in the shower, or when she's lying down, to massage the breasts with her hands in all quadrants so that she can turn up any kind of breast lesion that might be there. It is our Heavenly Father's desire that we should prosper and be in health. In fact, He has had His prophet to say that very thing, that above all things He desires that we prosper and be in health. It is our desire that we can teach you some things that will be of eternal blessing to you and to your family.